Antibiotics are medications that fight bacterial infections such as strep throat and urinary tract infections, but they are not for every sickness and they can cause side effects such as diarrhea. It is crucial to know when you need antibiotics and how to take them properly, because knowing about this will help you to benefit from these medications with the least risk. Bacteria are microscopic germs that live inside the body, on the skin, and around us. Some types of bacteria are not harmful, such as the ones in the gut and on the skin, help keep us healthy. But certain bacteria can make us sick, with effects ranging from mild infections to a severe one that lands us in the hospital. That's why antibiotics are so important. Let's get to know how antibiotics work. Antibiotics work by either killing bacteria or stopping them from multiplying. According to mechanism of action, antibiotics can be classified into two main categories, that is bactericidal and bacteriostatic. So an antibiotic can either be bacteriostatic or bactericidal. Bactericidal antibiotics, just from the word suicidal or to kill, are type of antibiotics that work by killing directly the bacteria causing the particular infection. They work by inhibiting cell wall synthesis of bacteria, thereby leading to their death. Example of such antibiotics are beta-lactam antibiotics such as penicillins and cephalosporins. Fluoroquinolones like ciprofloxacin and levofloxacin. Now let's talk about bacteriostatic antibiotics. Also from the word static, these type of antibiotics work by stopping the growth of the bacteria or inhibiting the reproduction of these bacteria without directly killing them. They do so by destroying the crucial parts they need to survive, such as the cell wall or the DNA. Examples of bacteriostatic antibiotics are macrolides like erythromycin and azithromycin, tetracyclines like doxycycline and minocycline. Bactericidal antibiotics are often preferred for severe infections, while bacteriostatic antibiotics may be preferred for less severe infections. Antibiotics treat a wide range of infections that may affect many parts of the body, from our innermost organs to the outer part of the skin. Examples of such infections are cellulitis, whooping cough, bacterial pneumonia, sexually transmitted infections, urinary tract infections, strep throat, and sepsis due to bacterial infection. When should you not take antibiotics? You shouldn't take antibiotics for viral infections. Antibiotics target bacteria, not viruses. So they don't work for conditions like common cold or runny nose, flu, sore throat, unless it is strep throat. You shouldn't also take antibiotics for a sinus infection caused by a virus. Antibiotics also come in different forms. We have antibiotics that we take by mouth, that is oral antibiotics. We have topical antibiotics, those that we apply on the skin. Injections or intravenous antibiotics are also available. Now, just as we think of our clothes in terms of groups, such as in casual wears or formal wears, healthcare providers also classify antibiotics in groups or in classes. Within each class, there are specific medicines, and those are the names we see on our prescription labels. Examples are cephalosporins that we also discussed, that they are also called bactericidal antibiotics. So now, examples of cephalosporins medicines that we can see on our prescription labels are cephalexin and cefaclor. We can also have penicillins like amoxicillin and ampicillin. Examples of macrolide antibiotics or bacteriostatic antibiotics that we can also see on our prescription labels are azithromycin, erythromycin, or clarithromycin. We can also see tetracyclines like doxycycline and minocycline. Now, what are broad-spectrum antibiotics? These antibiotics are those that target lots of different types of bacteria. Examples are quinolones and tetracyclines. And these type of broad-spectrum antibiotics are useful in situations where the bacteria causing a particular illness is not known yet. It's not clear which type of bacteria is causing a particular illness. It is advisable not to abuse antibiotics since they can cause antibiotic resistance. Antibiotic resistance happens when bacteria adapt, so they no longer respond to antibiotics that could previously get rid of them. That is why it is crucial to know when you need antibiotics, how to take them properly, and when not to abuse them. Thank you all for watching, and remember, antibiotics are powerful tools, so you have to use them responsibly. If you think you need antibiotics for a particular illness, contact a healthcare provider so you'll be guided. Like this video, share for me, and drop a comment below.